There's no question that having a high-functioning team is when we really are on fire. I mean, that's when the team is in flow and everybody knows what to do and nobody needs to talk about it, is one of the best feelings there is in the work that we do.
That was a cataract that was only light.
How do you take a surgical team with all these unique and diverse individuals and then see a team just connect and flow in just amazing mastery of the craft of the team itself?
How do you make decisions in a life and death situation? How do you get people to rapidly learn in an environment that is complex and challenging?
What would it look like if we brought to bear all the talent, all the expertise, multidisciplinary approach of world-class experts across all domains of human factors, and you focus it in on people who are saving lives?
The focus is not on the technical skill, it's actually on the team, the unit, performing at their best. So our focus in high performance medicine is bringing that thinking of the creative arts, elite athletes, and masters in sport into the world of healthcare.
When somebody from the world of ballet is observing a surgery and then provides you feedback about what they, in their words, the choreography of the surgical environment, and the people who are listening to that, who just were in that surgical environment, stopping and thinking, like, oh, I never thought about the nurse in this way. Or I never thought about, who is the leading and who is the follower in this particular choreography that would make it work better. That's where I think people really understand the value of diverse ways of thinking to help them get to where they want to go.
Patient safety right now in medicine is a very dry, kind of hard concept. How many people die, how many people have a stroke. Those are the lagging indicators of success. So to me, that intuition, that light bulb moment was, can we push that thought process back? And how do we get to that point? We make everybody perform at the top of their game. As technology gets more a part of what we do, we have to embrace it. One of the big holes in our understanding is like what happens to the human being during a stressful medical event, not the patient, but the providers. What does my heart rate do when the patient's really sick, or when there's a code, when the heart stops? That's not in mainstream healthcare at all, but that's where we need to get to.
We're at a point where technology is almost readjusting and retraining our mind of how to think. How do you train in that space? It comes back to this mantra, of always becoming an expert learner and not just an expert. Because as soon as you become an expert, that's it, you know it all, and you mentally and cognitively hit a firewall. But if you're always thinking about how to be an expert learner, you think about now, again, the exponential growth in how fast people learn and all the resources to allow you to learn faster.
And it's a very positive message. It's not an error message. It's an excellence message.
When you look at the state of healthcare in the 21st century, most people look to technology. They look to regulatory solutions or policy solutions. And our deep belief at Arena Labs is the future of world-class healthcare is not in regulation, policy, or technology, but in building high-performing teams.